Hey everyone, this is my presentation on the Mini Mental State Examination. This is the diagnostic tool that I chose to research for diagnostic reasoning. So what is the MMSE? As I stated before, MMSE stands for Mini Mental State Examination. This tool was developed by Marshall and Susan Folstein in 1975. They developed it because there was not a standard and reliable tool at the time to assess cognitive function that could be completed in 10 minutes or less. This tool consists of 11 items. The items test areas such as orientation, calculation, recall, following directions, reading, writing, copying, and more. Each item is individually scored. All of the items are summed, and a total score is calculated from those individual scores. The max score for this tool is 30, which indicates no cognitive function deficits. The lowest score is 0, indicating the most severe level of cognitive impairment. Usually a standard cut score of 24 is used to distinguish normal from abnormal, meaning if you got a score of 24 or above, that would be normal. Anything below a 24 is considered some degree of cognitive impairment. Additionally, according to Folstein, categories include severe as being less than 10, 10 to 19 being moderate, 20 to 24 being mild, and 25 to 30 being insignificant or no cognitive impairment. This is an example of the MMSE. This is actually the MMSE tool that is used exactly by providers in order to assess patients. As you can see, it is a pretty straightforward and easy to use tool. The provider basically goes through and asks the patient each one of these questions or asks them to perform activity depending on the item. And it includes questions such as what is the year, season, date, day, and month. This is to assess orientation. Another example is spelling the word world backwards. And also at the bottom you can see patient is given a blank piece of paper and asked to draw the symbol below. Each question or item is given a score, and then all of these items are tallied up, they're summed up, and the patient is given a total score at the bottom. As you can see in the right picture, the score can be interpreted based on different categories, and then the degree of impairment and the implications of that score are also included there. As for the patient presentation and use of the MMSE, this tool can actually be used to assess the level of cognitive functioning in any individual, but it is most commonly used if cognitive impairment is suspected, such as in patients with dementia, psychosis, major depressive disorder, bipolar disorder, and others. Some examples of when this tool would be used is when a patient is exhibiting early signs of dementia. The provider would administer the MMSE to establish a baseline, and then subsequently administer the MMSE to track progression of cognitive impairment as the dementia progresses. Another example is a patient with schizophrenia. The provider would administer the MMSE to establish a baseline, and then use that baseline compared to subsequent assessments using the MMSE to evaluate the patient as they progress with their treatment, and to evaluate whether or not the current treatment regimen is effective. And lastly, another example is administering the MMSE to gain an objective measure and then use that data, um, for example, the level of cognitive impairment of the patient, to make appropriate treatment plan decisions. In regards to the sensitivity, specificity, and predictive values for the MMSE, this tool has gained widespread support in the healthcare industry since 1975 when it was created, and it is being used frequently by many providers. Uh, Fulstein in 1975 demonstrated reliability and consistency by separating patients with or without cognitive impairment. And when these patients were reassessed with MMSE 24 hours apart by two different providers, similar results were obtained. Um, in 2007, Kali Rablowski and associates showed high diagnostic accuracy at a cut score of 24 with patients over the age of 90. The sensitivity was 0.85 and the specificity was 0.80. In 2008, O'Brien and Associates at a cut score of 24 found a sensitivity of 0.66, a specificity of 0.99, and a correct diagnostic accuracy of 88.9. They also decided to test at a cut score of 27, and they actually found the sensitivity to be 0.89 and the specificity to be 0.91 and the diagnostic accuracy to be 90.1% at this cut score. But it needs to be mentioned that in this study, these were college-educated individuals, which suggests that a higher cut score for the MMSE may need to be used for those with a college level education. Additionally, at this cut score of 27, there was a positive predictive value of 0.78 and a negative predictive value of 0.86. In regards to the cost to benefit ratio for the MMSE, it's not like many other typical labs or diagnostics that can be ordered that are very costly, time consuming, require a lot of resources to be expended to get the results. The MMSE is actually easily assessed, it's publicly available, very widely used, and it's low cost. It is basically just one piece of paper. The only identifiable cost factor related to its use is time. The MMSE takes 10 minutes or less of a provider's time in order to complete it. Thus, in a nutshell, the MMSE's benefit greatly outweighs the cost because there is little to no identifiable cost to using the MMSE, but there is a great amount of benefit. In regards to recommendations for the use of the MMSE, the MMSE is actually the suggested tool to be used during an initial assessment and subsequent assessments for suspected dementia. Additionally, the MMSE has proven effective in assessing patients with mental illnesses such as schizophrenia, major depressive disorder, bipolar disorder, anxiety disorder, and more, as proven and documented in the literature. Lastly, the MMSE can be used to obtain an objective measure of cognitive impairment along with other assessments to guide various treatment plan decisions. Some examples are based on the score of the MMSE and the degree of cognitive impairment. The provider can make appropriate treatment plan decisions such as, does the patient possess the capacity to live independently? Can the patient perform their activities of daily living independently? Does the patient require assistance Does the patient possess the capacity to gain employment and to maintain employment? Does the patient possess the capacity to make personal treatment decisions, such as taking their medication, deciding whether or not they need medication and whether or not they need to attend appointments and things like that? Uh, these are all guided treatment plan decisions that the MMSE helps the provider decide. In conclusion, the MMSE is a very useful tool due to the fact that it can be printed out. It's one piece of paper. It's portable, can be carried around in a briefcase. It is easy to administer. It is a reliable tool with high diagnostic accuracy, as I mentioned previously. Also, in regards to the cost to benefit ratio, there's little to no cost involved with its use. Um, in my future practice as a psychiatric mental health nurse practitioner, I do plan to use it because it does not require much time. It takes 10 minutes or less to administer it. It is great for objectively establishing a baseline. It's great for tracking progress over time compared to that baseline, and also it's just a good general aid to determine an appropriate treatment plan for a specific patient.